Hello. So we are continuing this series of videos on the advantages of corticobasal implants from the patient's point of view. So let's now discuss about the minimal bleeding, swelling, and discomfort,
Right.
which is so important.
Correct. So I think in the previous episode we had discussed about the single stage and keyhole surgeries.
Yes.
So the single stage surgeries per se has many advantages, and Dr. Prasanth will now explain to us as to how this is of advantage from the patient's perspective.
Yeah. So when you do a keyhole surgery, when you're just using a pilot drill and creating a small keyhole and operating on the patient, automatically the bleeding becomes considerably lower than when you open up an area and then try to drill in and then place an implant. So here we are just doing a keyhole surgery and there's minimal bleeding, and because the tissues are not affected much, the swelling, the post-operative swelling is also minimal, and therefore overall the discomfort experienced by the patient is considerably lower. Which
What
is
about
a huge
the
advantage.
pain factor? Pain is another major.
Certainly, the pain part is also very much considerably lower, minimal. Because see, pain. When does pain happen? Pain happens mainly when there is a swelling, when there is an inflammatory reaction. But when you do a keyhole surgery, the inflammatory part is very well under control. It's considerably low, and moreover, because it's a lot more it's a lot more faster with respect to the procedures, the patients also take it easily without much difficulty.
Right.
Which is a huge advantage. And even in cases where we've done full mouth rehabilitation with implants, after 4 or 5 days, when we review the patients, there is absolutely no swelling, nothing at all.
Right.
Which is not the case when you open up and then try to place an implant.
Right.
The postoperative edema is much higher, the bleeding tendency is much higher, the discomfort is much higher.
So discomfort is much lesser. That's what does.
In conventional implants,
right,
discomfort element is a lot more, but in corticobasal the discomfort is much lesser. That is a beauty. The other advantage is less costs. When you calculate the costs based on the time involved, there is a old adage, a saying that time is money.
Right.
So the more time you wait for a process to happen, the more money you lose. So the same thing applies here. So the more you wait, the more money is being spent.
Meaning the patients are earlier ambulated.
Absolutely.
You can go back to work, you can make your money.
Yeah, absolutely. And then so automatically, and moreover, when you are avoiding bone grafts, automatically the costs come down. In the other situation, you spend a lot of money on bone grafts, and even that really takes away a lot of money. So all these things are there. And the other advantage is you don't have to use general anesthesia. Most of the cases we perform are under local anesthesia. Even the zygomatic implants, the implants which we place into the zygomatic bone where there is lack of bone, we anchor it in the zygoma, which is the bone which is situated just below the eye, just below and towards the lateral aspect of the eye. So even in the case of zygoma, we place them under local anesthesia, which is not very often possible with conventional implants. They have to be taken up under general anesthesia in the hospital, and they'll have to be admitted in the hospital for almost maybe 2 to 3 days before they discharge. So all these things are there. But here, all these procedures are avoided, and we finish the procedures much faster. And the follow-up procedures are also a lot more straightforward and simple, thereby decreasing the cost for the patient, which is a huge advantage.
All right.
Then we come to the less post-operative problems. I've already discussed a few of them, but the most common long-term problem which people encounter is peri-implantitis in the case of conventional implants. So the bone around the implant tends to recede, and the implant becomes less supported, and the area gets infected, and then that leads to a lot of problems. And bone loss is minimal. In the case of in the case of corticobasal, the implant loosening or failure does not happen, as is the case with conventional implants, which can happen very often because of periimplantitis. Mechanical complications, like, because there are multiple parts, the multi-unit abutments, you have screw fractures, you have screw loosening. All these things do not happen here. And chronic pain and discomfort is considerably lower. Bite issues are considerably lower. Systemic health changes are very rare, and we are able to overcome many of the systemic issues with these implants. Bruxism effects can be minimized, and migration and drifting of the implants are also minimized, and maintenance challenges are considerably lower.
Okay.
So there are lots of advantages. And coming to maintenance, the regular cleaning, which any patient gets done in a normal dental clinic, is all what is required. You don't need special aids, you don't need specialized equipment for cleaning. Whereas in the case of conventional, you have to use specialized equipments. There are certain set protocols which are to be used. All this can be avoided with corticobasal.
All right. But don't take don't take it otherwise. You need to maintain your oral hygiene protocol strictly.
Certainly,
But
certainly, it doesn't mean that you can avoid visiting the dentist and getting your routine oral prophylaxis done. You have to get that done, no doubt, which is very important. And the patients are able to smile, speak, and chew confidently. I can show you these videos of this gentleman who came in from Portugal, who used to just demonstrate to me how he could take his denture out with his tongue, and this is the way he went with the fixed prosthesis. So he was a very happy man. And the other huge advantage is you're able to prevent facial collapse. Facial collapse is the condition where the face collapses backward and inward because of lack of bone stimulation. So this is a particular case of mine where he came in with really bad teeth, and this is how he went. You can see the sudden change in the age difference, and you can see the pre-operative and the post-operative picture, pre-op and post-op. You can see the side view. You can see he looks much younger with the implant prosthesis in place. You can see the smile has also changed. So these are huge advantages, the pre and the post X-ray. All this clearly shows how we are able to effect dental facelift, basically. Right. We call it a dental facelift.
So basically, since the full mouth rehab also focuses on a hybrid kind of a,
yes.
So you have you have a lip support.
Yes, very much. So very much there. So
that is one.
The youthfulness is maintained. Yes.
That is probably one of the reasons why.
So you can see this gentleman, how we could transform his smile, the pre and the post. He looks much younger. He's from Australia, and he was so happy when he left. He was a very apprehensive patient, but we could do a good job on him. You can see the pre and post of another patient, and here is another patient. So all this is what we call facelift dentistry. All this we are able to accomplish. You can see the pre-operative and the post-operative picture of a patient. So this is the transformation we are able to bring about in their lives. So I hope I could cover quite a few points with regard to the friendliness of these implants. We hope you like this video. Please press the bell icon and also subscribe to our channel. Please share this video with your friends. Thank you very much, Dr. Rupesh, for being here with me.
Thank you all
for the discussion. Thank you. Thank you.